Thank you for coming to this webinar. My name's Thomas Fowler and I'm coordinating the Summer in Dorset programme as part of Dorset Council. And I'm really delighted to have colleagues from both Public Health Dorset and Public Health England who are going to be leading this seminar through this afternoon, or webinar through this afternoon. So without further ado, I'm going to hand over to Jen Spencer from Public Health Dorset.
Good afternoon, everyone. Thank you for joining us for the Summer in Dorset Managing COVID Risk webinar. Hopefully you can all hear me okay and see the slides on your screen. As Tom mentioned, my name is Jen Spencer. I work for Public Health Dorset as a health programme advisor. I've been supporting the Summer in Dorset project from an infection prevention and control perspective. I'm not actually an expert on COVID-19, but I'm happy to be joined today by Dr. Fiona Neely from Public Health England, who is an expert, and also my colleague Susan is kindly here providing additional backup and support. I would just like to point out that all the information we're sharing today is correct as at Wednesday, the 22nd of July. So to give you a bit of an overview, your microphone and video have been disabled. The webinar is being recorded and a link to the recording will be shared. We will bring this webinar to a close no later than 3:30. There will be an opportunity for a Q&A at the end, so please make a note of your questions and submit these through the Teams Q&A facility, which you can find on the right-hand side of your screen. Your questions will be answered, hopefully, documented and shared electronically later on. We highly recommend that Summer in Dorset group providers keep up to date with the current national guidance, which, as I'm sure you may have noticed, it often changes. And so this webinar does just provide a brief summary only. So today we're going to recap the information that's recently been provided by Public Health Dorset to support the groups. We're going to have a quick look at the key measures to keep everybody safe. We're going to look at some advice for using personal protective equipment or PPE. We're going to very briefly discuss testing. We're going to explore a couple of scenarios and then I'll be sharing with you the useful contacts should you need to contact any of us. And then there is a question and answer session. When you have access to the recorded version of this and any slides, you'll find the resources at the end. And these are the same resources that you would find on your public health guidance document that was previously shared. So to recap the information that we have provided to you so far, you've received a Public Health Dorset guidance document. So hopefully that was useful as a bit of an overview and a summary to be able to get your group set up to be COVID safe. There's the online risk assessment, which hopefully you've been completing online, and this should be completed by Monday, the 27th of July. We've also very recently shared an action card, and this is what to do in the event of a suspected or confirmed COVID case. And as I mentioned, this webinar, including the Q&A, will be shared with you by Friday, the 24th of July. So that should hopefully be enough time for you to access all the information you need to be able to safely provide your groups. So the key measures to help prevent the spread of infection and protect staff and children. Wash your hands. I'm sure you've heard this message a lot in the media and in guidance. So that's 20 seconds. Clean, clean, clean. It's important to keep your environment as clean as possible. So that's all facilities, toys, equipment used by staff and children. Keep the groups small. So maximum of 15 for indoor based settings and 6 for outdoor based. You may have a few more questions on that. So of course, please do seek any clarification later in the Q&A. Avoid, where possible, or reduce mixing. So keep your groups consistent, a bit like the bubbles you would have heard for schools. When children attend your setting, try to keep them within the same group. And keep areas clutter-free and reduce sharing of equipment and any other things you may have in your setting to be able to run your group. When it comes to PPE, so again, that's personal protective equipment. These are just a couple of examples here for when this should be used. So for staff caring for a suspected or confirmed case of COVID, if coming within a 2-meter distance of the symptomatic person, the staff member should wear a mask, disposable gloves, and an apron. And in the case of cleaning staff, as a minimum, the following should be worn during cleaning. So disposable gloves and an apron. It's important that staff safely remove PPE and then thoroughly wash their hands after use. There are videos online explaining how to remove PPE safely. We will share these with you later. Should you need to access PPE, you can email the Summer in Dorset team using the email address shared on the screen. This will also be shared with you in other documentation. There'll also be a phone number that you can phone, but we haven't got that ready yet. So please look out for that. Right, so testing. So I'm going to discuss a couple of scenarios in a moment, and I would just like to point out that the need for testing underpins the scenarios I'm going to be discussing. So testing is obviously the way to find out whether or not someone has a confirmed case of COVID. So anybody with symptoms of COVID-19 should arrange to have a test. They can do this by visiting nhs.uk online or by contacting 119 via the telephone. Their household members should go home if they're in another location, and they should self-isolate for 14 days or until the individual who's had the symptoms tests negative. Further information can be found on the Summer in Dorset action card that I mentioned earlier, which contains a lot more detail on what to do if you have a suspected case, and again that includes information on when testing is required. So this is the first of our scenarios. What would you do if a child becomes unwell whilst at your setting and is displaying COVID symptoms? However, their parents can't collect them straight away, so they're having to stay at the group with these symptoms. So the advice we would give you is to arrange for collection of the child, and if they have any siblings at the group, they should also be collected by their parent, guardian or carer. Where possible, the child should be isolated in a ventilated room behind closed doors until they can be collected. Young people who can make their own way home safely can do so. They should avoid using public transport or coming into contact with others. So obviously the same would apply there for collection by the parents, carers or guardian. If isolation is not possible, the symptomatic person should be moved to an area at least 2 meters from other people. If an adult at the group needs to come within 2 meters of the child, as I mentioned earlier, they need to wear PPE, so that's gloves, mask and an apron. If the child needs to go to the bathroom, there should be a separate bathroom if possible. This should then be cleaned thoroughly with standard cleaning products before being used by others. If the child does test positive, the parent will get a text message and an email, and they will also then be asked to complete an email questionnaire describing contacts and activities. So moving on to scenario 2, what would you do if a child who was at your setting yesterday became unwell overnight with COVID symptoms? You should be aware that this is a possible case. Ask those with symptoms to isolate. They should not attend your group. Only send others home to isolate if they're part of the same household as the possible case, so all others can remain at the group. You can phone Public Health England, the health protection team, on the number on your screen. This number will also be shared elsewhere if you have any immediate concerns or if the case is confirmed by laboratory testing. So just to point out that official contact tracing will not happen until the case is confirmed. So our final scenario, what would you do if an immediate family member who lives in the same household of a child who attends the setting has a confirmed case of COVID? In this case, you should be aware that the child and their whole household need to self-isolate for 14 days and get tested if they develop symptoms. The child and their siblings should not attend the group, and then no further action is needed by the Summer in Dorset group. So as you can see, there's quite a few different scenarios that you may need to consider and different responses according to the scenario. So the majority of this is covered in the action card, and you'll have the opportunity to clarify or explore additional scenarios in the Q&A. If you need to make contact with Public Health Dorset for any queries around infection prevention and control, you can email us using the email address on your screen. If you need to contact the Summer in Dorset team, so this would be for general inquiries and PPE orders, again, you would email them at the Summer in Dorset email address, and the phone number will be shared later. And the South West Health Protection Team at Public Health England, they should be contacted only in relation to COVID confirmed cases or for any health protection questions or concerns. So you can see the email address and the phone number there on your screen. So just to reiterate again, we recommend that the groups keep up to date with the national guidance. At the end of this presentation is a list of all the various resources which will be updated centrally by the government and all the various different agencies as and when the national guidance changes. And we have only just provided a very brief summary.